Welcome back. In today's video, we're going to be going over differential reinforcement. Differential reinforcement is a procedure that identifies a problem behavior, known as the target behavior, and attempts to replace that behavior with a more appropriate one. This is done by putting the target behavior on extinction, which means the behavior will not receive any reinforcement in an attempt to reduce or eliminate its occurrence. The appropriate behavior, in turn, is reinforced to increase its occurrence. What is considered reinforcing will vary greatly from person to person, making it important to discover the function of the target behavior itself. For some, the reinforcer may be gaining attention from a therapist, teacher, or peer, or an escape from a task or setting, or access to tangible goods like a game, or access to edibles, to name a few. Specific models of differential reinforcement can vary greatly, so today we're going to go over the four basic types. First, differential reinforcement of other behavior, DRO. The second, differential reinforcement of an alternate behavior, DRA. Third, differential reinforcement of incompatible behavior, DRI. And finally, differential reinforcement of lower rates of behavior, DRL. Differential reinforcement of other behavior is a procedure in which the reinforcer is delivered for all behaviors excluding the specific target behavior. This means that as long as the target behavior does not occur, reinforcement is delivered. Because any other behavior is reinforced, a behavior that would usually not be reinforced, such as off-task behavior, is still reinforced. This is why DRO is best to use when the target behavior is severe and the treatment or intervention must have an immediate effect. Some examples would be self-injurious behavior, harm to others, or extreme property damage. A specified time interval is usually established in which reinforcement is delivered if the target behavior does not occur within it. The length of this interval depends on the current frequency of the behavior, ranging from 1-minute intervals all the way up to an entire day. One example in which DRO would be a good procedure to use would be an individual who is displaying severe self-injurious behavior. The therapist divides a 40-minute observation session into 20 2-minute intervals. Every 2 minutes that pass that the SIB behavior does not occur, regardless of the other behaviors the individual is engaging in, reinforcement is delivered. An example of DRO for a less severe behavior would be a student who refuses to stop shouting out in class. The teacher implements a DRO procedure that reinforces the student as long as they do not shout out for the entire class period. While DRO can be used for this second example, it is not the best differential reinforcement procedure to use because the behavior is not a danger to self, others, or property. Even if the student runs out of the room, they would still be reinforced. This next procedure would be better to use for this second example. Differential reinforcement of an alternative behavior, DRA, is a procedure in which the target behavior is replaced with an appropriate behavior that is designated by a member of the behavior intervention plan. The replacement appropriate behavior should serve a similar function, meaning why it occurs, to the target behavior that you're trying to replace. This first DRA example is very similar to the previous, but rather than reinforcing all behaviors except the target behavior as the DRO procedure requires, the talking out behavior is put on extinction and the teacher selects the raising hand behavior to replace it as the appropriate behavior. In the second DRA example, the function of the target behavior is to escape from a task. Reinforcement, which is escape from the task, is only delivered when the alternate behavior of displaying a break card occurs. The third procedure, differential reinforcement of incompatible behavior, DRI, is very similar to DRA insofar as an appropriate behavior solely receives reinforcement and the target behavior is placed on extinction. The important distinction between these two procedures is that DRI selects an appropriate behavior that is physically impossible to occur at the same time as the target behavior. Think back to the second example of DRA. The individual could potentially hold up the break card while engaging in aggressive behavior. The two are not physically incompatible. An example of DRI would be a teacher who targets a student's out-of-seat behavior. The teacher decides to reinforce a replacement appropriate behavior of staying seated. A second example would be a client with autism who frequently displays a hand-flapping self-stimulatory behavior. The therapist reinforces a more socially appropriate behavior of thumb twirling. Because hand flapping and thumb twirling cannot occur simultaneously, they are incompatible. The final procedure I will be discussing in this video is slightly different than the other three. Differential reinforcement of lower rates of behavior, DRL, rather than reinforcing an alternative behavior, attempts to reduce the occurrences of the target behavior. DRL is usually implemented for a behavior that you are not trying to fully eliminate from the client's repertoire. This is done in two ways most commonly. The first, a certain amount of time must pass between the end of the target behavior and its reoccurrence. In the second, a certain time interval is set and the behavior must occur at or below a certain set of criteria. One example of where a DRL procedure would be used is a student who frequently requests a break in a math class. The teacher sets a criteria that once a break is given and ended, 15 minutes must pass before another break is given. In a second example, an individual with severe disabilities displays frequent self-stimulatory behavior during a session. The therapist sets a criteria that the target behavior must not exceed 10 occurrences in a single session for reinforcement to be given. DRL looks very similar to a changing criteria design. A criteria is established that is very close to the normative occurrences of the target behavior. As each criterion is met, slowly increase the requirements. In the first DRL example, for instance, the teacher could at first require 5 minutes to pass, then 10 minutes, then 15, then 20, and so on. I hope this video made differential reinforcement clear. Thanks for watching.